It is a quiet Tuesday morning in January. Margaret, age 72, walks to her mailbox like she does every day. She pulls out a thick envelope from her Medicare Advantage plan. She sits down at her kitchen table, opens it, and her hands begin to shake. The dental allowance she used for her dentures? Cut from $3,000 to just $350. The over-the-counter card she used for vitamins, bandages, and pain relievers? Gone. The gym membership that kept her moving after her hip surgery? Canceled. The free rides to her cardiologist? No longer covered. Margaret didn't do anything wrong. She didn't break any rule. She didn't miss any payment. But on January 1st, 2026, the federal government quietly ended a program called VBID. And just like that, millions of seniors woke up to a Medicare plan they no longer recognized. And here is the worst part. If Margaret does not act fast, she is locked into this gutted plan for the entire year. Hello, my friend. I am Milena, your senior policy analyst, and I have spent years helping retirees just like you understand the fine print that insurance companies and government agencies hope you never read. Today, I am going to walk you through, step by step, exactly what just happened to your Medicare Advantage plan, why your dental, vision, gym, and grocery benefits may have disappeared, and the precise actions you must take before March 31st to protect yourself. And please, I am asking you, stay with me until the very end of this video, because there is one hidden mistake that millions of seniors are making right now, a mistake that can permanently lock you out of better coverage and even cause you to be denied a Medigap policy for the rest of your life. I will reveal exactly what that mistake is and how to avoid it. So take a breath, sit back, you are in the right place. Let me tell you about Robert. Robert is 67 years old. He retired 3 years ago from a long career as a high school math teacher in Ohio. He is the kind of man who pays his bills on time, files his taxes early, and reads every piece of mail twice, or so he thought. Back in September, Robert received a thick envelope from his Medicare Advantage plan. The outside looked like marketing, glossy, colorful, full of smiling faces. He assumed it was just another sales pitch from the insurance company, so he tossed it in the recycling bin without opening it. That envelope was his annual notice of change, the one document required by federal law that listed every single benefit being cut from his plan. Robert had no idea. October passed, November passed, December 7th came and went. The annual open enrollment period closed. Robert never compared plans. He never called anyone. He never knew anything was wrong. Then January arrived. Robert went to the dentist for a routine cleaning and a crown his dentist had been recommending. He expected the crown to be covered because last year his plan had a $3,000 dental allowance. The receptionist looked at her screen, frowned, and said, "Mr. Robert, your plan now caps dental at $350 every 6 months. Your crown will be $1,400 out of pocket." Robert was stunned. He drove home and called his plan. The representative was polite but firm. "Sir, this change was disclosed in your annual notice of change, mailed in September. You had until December 7th to switch plans." Then Robert tried to do the smart thing. He called to switch back to original Medicare and buy a Medigap supplement plan. But because he was past his initial Medigap enrollment window, the insurance company required medical underwriting. They reviewed his history, his type 2 diabetes, his mild heart condition, and they denied him. Robert is now stuck in a gutted plan for the entire year of 2026, paying thousands of dollars out of pocket, with no way out. And he made just one small mistake. He threw away a letter. Do not be Robert. Now let me explain exactly what happened using the official documents straight from the federal government. I want you to see this with your own eyes. What is VBID and why did it end? VBID stands for the Value-Based Insurance Design Model. It was a pilot program that started in 2017. It allowed Medicare Advantage plans to offer extra benefits to vulnerable seniors, things like food and grocery allowances, free transportation to medical appointments, reduced prescription costs, and chronic condition support. More than 7 million Medicare Advantage enrollees were receiving these benefits. 62 different insurance companies were participating. But on December 16, 2024, CMS, the Centers for Medicare and Medicaid Services, announced that the program was being terminated. The reason? Excess costs. According to CMS's own published numbers, the program cost Medicare $2.3 billion in 2021 and another $2.2 billion in 2022. Federal law requires these pilot programs to either save money or improve quality without raising costs. VBID did neither, so it was killed. The termination took effect January 1st, 2026. What benefits are actually being cut? According to the Kaiser Family Foundation, which analyzed every Medicare Advantage plan in the country using CMS landscape files, here is what changed between 2025 and 2026. Over-the-counter allowances? Offered by 73% of plans in 2025, now only 66% in 2026. Meal benefits? Dropped from 65% to 57%. Transportation for medical needs? Dropped from 30% of plans down to just 24%. Now here's the part that confuses most seniors, and I want you to pay close attention to this. Dental, vision, and hearing benefits are still listed in 98% of plans. So when you call your plan, the agent will tell you, don't worry, you still have dental coverage. That is technically true, but what they will not tell you is that the dollar amount inside that benefit has been gutted. A $3,000 annual dental allowance can be reduced to $350. A $200 quarterly OTC card can disappear entirely. A nationwide gym network can be replaced by a single local facility you have never heard of. The benefit name survives. The value collapses. That is the trick. That is what you need to understand. The legal notification you must not ignore. By federal law, under Title 42 of the Code of Federal Regulations, Sections 422.111 and 423.128, your plan is required to mail you an annual notice of change, called the ANOC, by September 30th every year. This document lists, line by line, every benefit cut, every cost increase, every network change taking effect on January 1st. It is the only legal warning you will ever receive. If you threw yours away like Robert did, call your plan today and request a copy. Other changes hitting in 2026. A few more facts you must know, all confirmed by AARP and CMS. The Part D prescription drug out-of-pocket cap rose from $2,000 to $2,100. The maximum Part D deductible rose from $590 to $615. The standard Part B premium is now $202.90 per month. And in 6 states, Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington, even Original Medicare is now testing prior authorization on 17 categories of services through a new pilot called Wiser. That means even traditional Medicare beneficiaries may suddenly need approval for procedures that used to be automatic. This is not a small change. This is the biggest single-year reshaping of senior health benefits in over a decade. Now listen carefully. Here are the 3 exact actions you must take in order before March 31st, 2026. Step 1. Find your annual notice of change and read it line by line. Pull out that envelope from September or October. If you cannot find it, call your plan directly and request another copy. They are legally required to provide one. Compare every benefit, dental, vision, OTC, gym, transportation, against what you had in 2025. Write the cuts down on a piece of paper. You need to see in writing exactly what was taken from you. Step 2. Call your free state health insurance assistance program, known as SHIP. SHIP is a federally funded counseling program available in every state. Their counselors are not insurance salespeople. They do not earn commissions. They are trained, unbiased experts who will sit with you, review your ANOC, and compare it against every other plan in your county for free. Go to Medicare.gov, click Talk to Someone, and find your state's SHIP phone number, or call 1-800-MEDICARE, which is 1-800-633-4227. Step 3. Use your Medicare Advantage open enrollment period before March 31st. From January 1st through March 31st, you have a one-time window every year to either switch to a different Medicare Advantage plan or drop your Medicare Advantage plan and return to Original Medicare with a standalone Part D drug plan. After March 31st, that door closes until October. But here is the hidden mistake I promised to reveal at the start of this video. Please listen carefully. If you drop your Medicare Advantage plan to return to Original Medicare, you will likely want a Medigap supplement to cover the gaps. But in 46 states, Medigap insurance companies are legally allowed to require medical underwriting. That means they can look at your health history, your diabetes, your heart condition, your cancer history, and they can deny you or charge you double, triple, even 4 times the standard rate. Only 4 states protect you year-round: Connecticut, Maine, Massachusetts, and New York. There is one exception. If you joined a Medicare Advantage plan when you first became eligible for Medicare at age 65, you have a 12-month trial right to drop it and get any Medigap policy without underwriting. After that window closes, the protection is gone forever. Before you drop your Medicare Advantage plan, call a Medigap insurer first and confirm in writing that you will be accepted. Never ever drop one plan before the next one is secured. This is the single most expensive mistake a senior can make in retirement. Do not make it. My friend, I want you to hear me clearly. The rules affecting your Social Security, your Medicare, your pension, your bank account, and your retirement security are changing faster than at any point in the last 20 years, and the federal government is not going to call you. Your insurance company is not going to warn you. Even YouTube does not always show you my videos when these urgent alerts come out because their notification system is unreliable, especially for seniors. That is why I created a private space just for you. Right below this video, in the description, you will find a link to join the Global Senior Alerts official WhatsApp channel. When you join, you will receive two things immediately. First, a free download of my Senior Benefits Protection Guide, a step-by-step PDF that walks you through how to protect your Social Security payments, your Medicare coverage, your pension income, your bank accounts, and your insurance claims, all in plain English. Second, real-time alerts sent directly to your phone the moment any new rule changes affecting seniors are announced. No more missed letters, no more surprises in January. It is completely free. It takes 30 seconds to join, and it could save you thousands of dollars and protect benefits you have earned over a lifetime of hard work. Click the link in the description right now. Do it before you forget. Do it before the next change catches you off guard, the way it caught Margaret and Robert. You worked your whole life for these benefits. You deserve to keep every single one of them. I am Milena, and I will see you in the next alert. Stay safe, stay informed, and stay protected.